Good morning, I am Kevin Price. Delighted to be with you. Going to spend some time talking to you about you and your business. And as usual, I've got a lot of talk about. Somebody gets straight to it. As any regular listener knows, I have a ongoing feature, continuing series that I'm doing with Frank Granite with a great group called CAOOY.org. And it's a partnership that they have with the Price of Business, and we call it the Price of ADHD Business. And, in fact, Frank has a recent article in the lifestyle section at usdailyreview.com that I definitely want you to check out. And in addition to that, we've got a great guest that I've been looking forward to today. Frank, before you get to your guest, tell us about the good work you're doing there at CAOOY, what it's about, and by the way, that's CAOOY.org.
Yeah, great to be on again, Kevin. And you and I, when we started our campaign, a national campaign months ago, we're basically uniting healthcare professionals across the country to realize let's get after these underlying risk factors that are actually causing the condition. And, you know, our Coalition Against Over-Medicating Our Youth is a nonprofit public education charity. And its mission is basically to help parents, to help their kids get back on track prior to going to that premature drug therapy intervention. And today, Kevin, it's no different. We have a great guest on our segment today. She's a clinical neuropsychologist from Chicago, and her practice, it's the North Shore Pediatric Therapy Centers. There's 5 locations out of Chicago, and she's doing great work there because they use a multidiscipline force, if you will, of different healthcare professionals to help kids get back on track. Her name is Dr. Amy Wallock. Amy, great to have you on our program today.
Thanks for having me.
We're glad to have you on the program. Why don't we start off real quickly with kind of giving us an overview of your practice?
Sure. So here in Chicago, as Frank mentioned, we actually have 7 locations. We just recently opened 2 new ones around the Chicago suburbs. And we're a multidisciplinary team here. We have a clinic of neuropsychologists. We have speech-language pathologists, occupational therapists, physical therapists, social workers, and even a dietitian. And specifically in our neuropsychology clinic, our focus is on conducting thorough evaluations of kids coming in to see us with various problems and really help guide them in an effective and practical treatment approach.
And you know, Dr. Wallock, when you're looking at a child, let's say you have a mom that's bringing their young child in that's newly diagnosed, and they're having that debate, if you will, with the school as far as should I medicate or should I not. And our coalition is not against medication. We just, like you say, we want to get through these assessments because that's the most critical point, in helping a child get back on track. So in your office or in your practice, what is a good success story? I mean, could you relate a child that has come to you, and how did you go about? Like, what's the first 3 interventions that you utilize for that child?
For a child with ADHD specifically?
Yes, let's focus on the ADHD condition for right now.
So, first of all, the most important thing is to get an accurate diagnosis. So when a child comes to me with symptoms of ADHD, we want to really look at the child thoroughly from all different angles and really make sure we know what we're looking at. If a diagnosis of ADHD is confirmed, then, of course, we want to focus on a multimodal approach to treatment. Of course, every child is different, and here at North Shore Pediatric Therapy, our recommendations are definitely individualized, but also based upon what we know from the literature of what works. So I would say the number one recommendation would be psychoeducation for the parents, for the teachers, any adults involved in the child's life, and depending upon the child's age and level of insight, psychoeducation for them as well. Second,
real quickly, I'd like you to go ahead and make sure we get your website in for people to get more information?
Oh, sure. It's kidsblossom.org.
Very good. Go ahead. There's your next question.
And, Dr. Wallock, you said the 2 and 3 points. Just really quick on the brief side for that. I mean, I know you want to assess them first, like you were saying, but in a good success story, what's the second and third as you're going forward with this child to get them back on track?
Sure. So we definitely want to be collaborating with the school since the child is spending a great deal of their week in the classroom, and we often get our referrals initially from teacher concerns going to the parent. So we have put into place various behavior strategies that have been helpful, and when it has its place, we do recommend that they speak with their pediatrician about a medication trial.
Yeah, very interesting. How old is the practice itself? How long have you been doing this?
I've been doing this for going on, I've been licensed for about a year and a half, and I've been doing this for about more than 5 years.
Interesting, very interesting.
And as far as Dr. Wallock, the NTA study that you mentioned, when we talk about medicating children, and I'd like our listeners to understand, medication is not a bad thing because the child sometimes has to be stabilized first. But explain what this NTA study briefly and how it's very important when you have a behavioral assessment, a good comprehensive behavioral assessment, before this child goes on an ADHD type stimulant medication.
Sure. So the MTA study is the longest running study of children with ADHD that's ever been done. And basically what has come out, and data continues to come out currently, is that medication can definitely be effective, but it's not effective for every single child. And that in the long term, it really won't make a difference in really helping to manage those core symptoms of ADHD. Really what they found was that the combination of medication of those core symptoms, but then also various forms of behavior therapy is most effective in helping a child over the long term.
Very interesting. By the way, I do want to mention that the website for Frank is CAOOY.org. Let me ask you in terms, Doctor, of what kind of interest you're getting in your approach, because it sounds pretty, I won't say revolutionary, but certainly refreshing.
I think from parents, or who are you asking?
The medical community in general, but parents as well.
I think that we certainly approach our practice and recommendations using an evidence-based approach. So certainly we follow guidelines that are not out of the realm of what other clinical psychologists would be necessarily recommending. Parents are they're happy to know their options. They first of all want to know what is going on with their child. Second of all, they want to know how they can help their child. And we at North Shore Pediatric Therapy want to give them multiple options. My job is to tell them what has been shown to work in the literature, and from my clinical practice, what has worked. Certainly parents do appreciate that we've taken a thorough look and really thought about their child in great detail about what would be the best approach for them. And if medication is one of our top recommendations, then they feel as if it's been thought out, and it's not just been jumped to as a cure-all.
Yeah. Well, it seems to me to be a very refreshing approach. I don't want to sound like it's an odd approach. I like it, actually, and it seems very balanced. And I guess, being the parent of 8 kids, I can't tell you how quickly doctors want to move to drugs automatically. And to me, it just seems like a much more balanced approach that you're taking. You're not saying drugs are bad, but certainly we should explore other courses first. Frank, we're about out of time. Why don't you wrap up with your final thoughts?
Yeah, you know what, Dr. Wallock, thanks for your perspective, and we appreciate the work you're doing up there in Chicago. And for all of our listeners, look for the complete comprehensive assessments on caooy.org. The action plan is right in the website. And please visit Dr. Wallock's website as well. And remember to have comprehensive assessment before premature drug therapy, especially in our young child population.
Thanks to both of you for a great segment. I do want to encourage you to learn more about it. You can go to usdailyreview.com. We'll have information there as well. And, of course, you can go to their website, caooy.org. And then Dr. Wallock, you can learn more at kidsblossom.org. Great segment. Thanks to both of you.
Thank you.
When we come back, much more for you right here on The Price of Business.
Ooh, the red wine.